Ghana has been chosen as the, what do we call it, the epicenter for the treatment, or?
No. People get it wrong. Ghana on 23rd September, Ghana was chosen by the UN Security Council.
Oh, we didn't volunteer. I thought we volunteered.
Ghana was chosen.
We volunteered.
We might have put in an interest, but Ghana was chosen.
But we volunteered.
Because Ghana is not even on the Security Council anyway. 15 countries in the Security Council, Ghana is not.
Well, none of them is in West Africa,
though. Nigeria is there.
No, Nigeria has been there.
Nigeria is on the Security Council.
By the virtue of the fact that they have cases. So they
not that. They are. You see, the US, apart from 5 permanent members, there are 10 members that rotate. Nigeria is there. But what I'm saying is that Ghana was chosen. Ghana was chosen. I think that we haven't yet thought through, like my uncle always said, you need to think and plan. I haven't seen any UN mission.
We were not ready.
I'm telling you, I haven't seen any UN mission set outside the place of theater of events. UN goes to where the theater of events is. And I tell people, the Russians have set up in Guinea. The Americans have set up in Liberia. The British are setting up in Sierra Leone. Why come to Ghana? The UN has a peace and security mission in Ivory Coast, which is the border town, a border country.
So you're not happy that we have it?
Let's look. I'm not happy. The UN has a peace and security mission in Liberia. The UN has a peace and security mission in Guinea. The UN has a political office in Dakar.
So your point is?
My point is that coming to waste 100 people here, build houses and pay for them, that cost for a year could have built Ebola treatment centers in those affected countries.
But why are you worried? That's the problem with the UN.
I am worried, especially when your own country has issued a travel advisory ban on the citizens. You now bring people, 250 people here, 150 of which are traveling to and fro. You are going to base your helicopters here. Ask me and you speak. The Liberian chief medical officer is under quarantine. Why? He's not treating patients too. He's a coordinator, but an assistant of his has died. The mere movement from affected country to non-affected country in epidemic terminology, you can introduce that virus. Just the mere movement.
Even though they may not directly be involved in treatment.
Let me tell you, the 150 are directly going to get in contact with coordination and things in Liberia. Look, one Liberian got to America.
That's all, Duncan. That's all.
And Americans have these guns and everything. They have even ones that when you pass through, it remotely takes your price. Why? They have introduced it. And the UN, when the man was doing the press conference, he told Ghanaians that when a staff, one of the members get affected, he will be treated in Ghana, he'll take it there. What about if the person has affected other Ghanaians? So we have to know the protocol they sign, whether those 250 people are going to interact with Ghanaians, and how we are going to make sure.
But we've been given all the assurance. I don't know why Napo seems to be so much worked up.
Nobody can give an assurance. When that person tells you, when any of our staff get affected, we are going to send
Ebola,
the person away.
Assurance.
What?
What? It could mean capacity building.
Ebola.
We're going to have technology transfer.
Ebola.
We're going. I mean, on the aesthetics alone, Ghana is going to be seen as a country that is very much hospitable, very much receptive, and very much in use for some of these significant.
It could be a good idea. It could be a good idea that they are setting up here because there are certain things that we don't have that they'll be able to do for us in terms of making sure that we have the centers and all that. But look at Duncan. I'll refer back to Duncan, the guy who went to America. Did they know, when he got on the plane, did anybody know he had Ebola? When he got off the plane, went through the airport, did anybody know he had Ebola? When he even went to the hospital to report that he's coming from an Ebola-infected area, did anybody know he had Ebola? Now that
he stayed 4 days.
Now that they realize he has Ebola.
He's infected almost everybody.
That is it.
And the schools around his community, the neighbors are all allowed.
That is it.
So that's the scenario you're painting.
Yes.
That is the we need reassurance. Yes. They should demonstrate how it cannot happen.
They should tell us that if it so happens that one of these 250 people contract Ebola, how are they going to handle it?
But what's the worry? What's the worry when they where are they? They'll be cut somewhere around the airport.
What about the contacts?
And then they'll be having face-to-face meetings with Ghanaian health officials I don't know why Napo is worked up.
Let me ask you something.
I'm really worked up.
Napo, let me ask you something. When you enter your building here, what caption have you got on your door?
The studio on it.
No, downstairs. You haven't seen it.
Yeah, I haven't read it.
No. We have.
Why? Why you put that there?
No shaking of hands.
Because Ebola doesn't discriminate. Look, if I have a drop of sweat on my hand here and I touch you, you can get Ebola. You can get Ebola. It does not discriminate. And Ebola can infect the whole world if you are not careful. At the present moment, Liberia, apart from the fact that they went through a war and lost a lot of people, to them this is a war. It is good. If they don't take care, it would decimate Liberia for good. Because how many are they? They're only about 3 million, 4 million people. How many people have died from Ebola today in Liberia?
Well, Napoleon, for many people, for many people, all right, for many people, this is a gesture that should be praiseworthy. You see, very commendable.
Now, I don't want to talk about the government that believes in rhetoric and semantics.
I've heard the Minister of Communication say over the last few weeks that this also is going to ensure that Ghanaian medical experts are also going to get a lot more knowledge transfer.
Did you listen to the press statement?
Well, I did.
The guy who is in head says they are going to follow protocols established by the Ministry of Health.
And we have good protocols.
I'm saying, so don't even start talking about technology transfer. The only thing these people can transfer to us is the buildings and the cars they will leave behind.
What are those protocols?
What are the protocols that they've signed?
What are those protocols that they are following to the Ministry of Health?
It's not all of us that will jump left, right, and center on somebody's rhetoric. I'm not going to be in a propaganda game. This is a disease that can decimate Ghana. So when somebody is traveling, look, the ministry, did you hear that the Ministry of Foreign Affairs prevented the Sierra Leoneans come to play a football match? Banned all conferences in Ghana for 3 months, international conferences.
I know.
Even prevented secondary school and university students from coming. And now you say 250 people, 150 of which are going to Ebola countries and coming. Why do they have to go and come? Sierra Leone has got a seaport. Liberia has got a seaport. Guinea has got a seaport. The longest running in probably West Africa is in Monrovia. They could have set up logistics centers in any of those countries to distribute among the poorly affected countries and see that the treatment does not spread. Why would you jump between Ivory Coast and Sierra Leone and come to Ghana?
Let me give you a typical example.
But he's a medical doctor.
Let me give you
that's why I'm very, very worried.
Doesn't it make a lot more sense that you don't establish in the epicenter?
Tell me a UN mission that is established outside an epicenter.
Let me tell you something. Even if, yes, they wanted to establish this, they could have done it not on land.
On sea?
Yes,
it should have been on somewhere. On.
Let me ask you
some floating vessel.
Wait. Don't we have doctors coming in?
Lagos 2 and all those missions.
Don't we have doctors coming in on huge ships to perform?
Cruises.
Yes. Yeah. Couldn't we do that? Couldn't they station this outside the waters?
Maybe they didn't have the resources.
They have it. They have it. Don't say that. They have it.
Oh, please. My fear is that if one of these 250 people contracts the disease.
I don't get you.
It's 21
How would
days.
they come into contact? They'll come into contact with the president, the health ministers, etc. With members of parliament.
You haven't even read.
They'll come. No, wait. With the president, etc. As far as I'm not talking about what they're going to do in Liberia. When they come down and we have to do discussions and how.
So they'll get in contact with me. So you are not worried.
No.
So they have this. You just said that.
No, that's not what I said.
So you're saying that.
No, he's drawing conclusions of what I'm saying.
They'll get.
No, let me clarify my statement. All that I meant was that the number of people they're going to meet are going to be few.
No, they are not.
Oh, please let me.
They are not.
Nana Poku, please let me finish my statement. And so I am thinking, my interpretation is that before they meet even the top leadership of our country, and also includes members of parliament and people like you, they would have observed the necessary protocols and medical observations. And so there wouldn't have been any fears. All these fears would have been allayed by them.
Ghanaians should question the procedures that they are going to use when they go into these countries. What is it actually they are going to do in these countries? They should sit down and tell Ghana, because at the present moment we are Ebola free. We are Ebola free. So it is up to Ghanaians to question. So you've come to set up here. You're going into Ebola affected countries. How are you going to do it? How are you going to assure us that when you get there, you're not going to come back with Ebola?
I don't get. For me, I still don't get you.
You won't get it.
The people come. They are in the plane.
It happens. Some of you are only waiting for doomsday before you think.
No. I think you're rather predicting doomsday.
I'm not. No, I'm saying some of you are waiting for doomsday before you. Know.
So you are predicting.
I'm not predicting.
Okay. So
I'm saying, let us know the protocols. Look, I'm telling you, I don't think that when they set up, any Ghanaian should be allowed entry into that place. It should be an exclusive zone, like my uncle was saying. They could have done that.
But if they want to meet the top leadership of political parties and MPs,
what for?
And you will be part of it. You wouldn't have attended the meeting, Napo.
I'm going there from here, 10 o'clock. I'm meeting them, and I'm going to put this question in even a more harsher way.
You're not going to shake hands?
Why should I shake them? When my president went to those 3 countries, didn't you hear the same Dr. Omani Boamas coming that he didn't shake anybody? Didn't you hear that? Even if the president of the Republic of Ghana went to visit his colleague, a president of a country, we were told by the communication experts in this country, John Mama didn't touch anybody. Why?
You see, amongst all this, what we should be doing is to strengthen those centers.
Cholera, even cholera we can't. There's Ebola.
If it so happens, Napo is saying somebody made a correlation between cholera, Ebola, and HIV. I said they are all brothers. Why?
No.
Because they infect your immune system. They are all brothers. They are all derivatives of one another.
No.
And mine is that it was a joke on WhatsApp. And mine is that because
2 are viral infections.
Because whatever it is, it kills. How many people have
rapidly?
How many people have died from cholera today?
But
let me just finish. Mine is that at the present moment, let's strengthen those centers in case we get someone infected by Ebola here. Let's try and strengthen those centers that will treat Ebola in all the regions if we can. I believe that even if we were to use a bit of our oil revenue to do that,
that's the proper use of money.
It will help us.
Proper use of
if
money.
We say that, okay, we are taking X from our oil revenue to set up these centers because we know it directly affects the people. I mean, that is my case. It directly affects the people.
And upon this is what government has been doing. So far, we've had distribution of PPEs.
I wish 9,000. I wish you hadn't said that. What the government. Because I can also show you the Ministry of Health later. That is directly. We've heard all these stories long. The Parliamentary Committee.
9,000 PPEs, aren't they significant?
I will come into that. Parliamentary Committee, not health, that you say Napo has been influencing them, on defense and interior, went from Upper East to Volta region, Aflao, and they came back crying, led by Fritz Baffo. No protection equipment, nothing. Yes, led by Fritz Baffo, chairman of the committee. So what I'm talking about, I'm not talking about it in a partisan way. I'm talking about critiquing the government policy. That's all I'm talking about. If Ebola should happen, look, when a rumor went around that when somebody touches you in Ghana, something happens to you. People got killed in this country.
Yes.
Let me tell you, if it is known that somebody who has been affected by Ebola came to Joy FM 4 days before and did a program, nobody will enter the studios of Joy FM. Nobody will enter the studios of Joy FM in this country. Let us assume, without admitting, that somebody gets infected in Ghana, and we heard that he was on your program. Who will enter the studio of Joy FM in Ghana? Ghana's panic situation is different from Liberia and Sierra Leone. They are very, very small populations. Look at Accra. Which hospital in Accra is equipped to deal with Ebola? Tell me. And which patient?
Kolebu Teaching Hospital.
If they send an Ebola patient to Kolebu Teaching Hospital, who will go to Kolebu again in this country? There are no protection. The hospitals are being written to tell them they should buy their own PPEs. And the government is doing propaganda that have acquired 9,000. Those questions I'll ask today. So if you can write a letter to the hospitals directing that they should buy from a particular company in an emergency situation, the government has every international right to have acquired all those things, whether you have money or not, and distributed. They didn't do that. It had a letter they wrote to hospitals, buy your own PPEs, we will refund. Why did the government buy it at source and distribute? We have a problem with our medical system, a health system, a public health system that cannot deal with cholera.
Exactly.
That we have the worst fatality case in the history of this country out of cholera.
Yes, cholera.
We shouldn't delude ourselves into thinking.
Now we've had over 17,000 cases.
Let me tell you, and the number of deaths is the worst in this happened in the history of Ghana. Let me tell you, I've seen 2 presidents in this country be veiled by their medical establishment. I've seen 2 presidents. President Kufuor's car somersaulted at Silver Star Towers. He was taken to castle to go and to meet chiefs from a certain region. Some people had to go and shout before he was taken. Our president, late president, had a medical problem in Castle. Not even an ambulance was one. And that is the #1 citizens of the land.
There was an ambulance we were told of.
But the national ambulance that took him. And I'm telling you,
those are speculations. There hasn't been confirmed.
My own dad walked into confirmation.
The investigation you did was independent.
Wait,
it's not been verified.
Don't bring politics into it. I'm talking about facts. My dad walked into Kofanochi, the best A&E in this country, and came back in a wooden casket. And all he needed was less than 1 cedi spray on the tank.
That's all.
I'm telling you, our emergency situation in this country is bogus. And that is what can kill us. And that is why I panic when we can introduce inadvertently Ebola into this country by our inactions.
Have we taken the right steps? I know it was covered significantly during the week by the BBC as well, where they went to border communities and the hospitals didn't have the PPEs.
To 9,000 away.
Now, we've had Joy News, Multi-TV, go around the hospitals, not available. Other media stations have done so, especially in the border communities. Are we just paying lip service to it? All these niceties about having an established center here, being manned by the UN, etc. But as far as what we need to do in the locale, we're not doing them.
We should look at what is happening in Liberia. A true reflection of what can happen here if Ebola gets in here. And based on that,
their health system is worse than ours.
Irrespective of whether
because it's been dissipated. It's been dissipated by war.
Please forget. Don't tell me about health systems in West Africa. Health systems in West Africa cannot stand the test of time. Cannot stand the test of time. That's why I keep saying, there are certain things which every government has to take seriously when they come into power. Health is one. Education, energy, agriculture. These things are so fundamental which affect the people. And at the present moment, do you think we have good health facilities in this country? When Kolebu itself does not have a lift, pregnant women have to climb right up to the floor to be able to...
Kolebu has a lift. Sometimes the lift breaks down. So I think we have to put all these into perspective.
It's all part of it.
But that's mechanical.
It is,
mechanical things
please,
break down.
it is not mechanical.
That should really happen then, even mechanical.
So you're trying to tell me that the lift should once in a while break down? It's called maintenance.
I'm trying to tell you that if it breaks down, there's nothing wrong with it. Because sometimes these are mechanical, it can break down.
There is something wrong with
your car can break down. Doesn't mean that you don't service
the car. Headline news.
That is my personal car.
It's not headline news.
My personal car.
It's not headline news.
Something that affects the people. And at the present moment, Ebola is a scourge. What did the Chinese do when bird flu happened in their country? They quarantined and made sure that before you even enter, you are tested at the airport. And if any...
But still we had a number of cases being recorded around the world.
Yes, a number of cases, but it was reduced. At least it wasn't too bad. When you get into Kotoka, what are you shown?
Well, the last time you were there, what did you see?
No, just a temperature gun.
A gun, yeah.
That's all.
But it's good enough to first get an assessment of what your temperature is. Before the next step is taken.
How well have we trained the people there? Is there an ambulance, standby?
When you talk to them, they said they were not well trained. Because we've been told by the Ministry of Health as well as the agency that has been, the committee that has been set up
a standby ambulance
to look at Ebola. That they have done a lot of reorientation.
They take your temperature, and your temperature is 48 something. Is there an ambulance standing nearby? Are these, in fact,
just close by we have the airport clinic, and the last time I was there, there were 2 ambulances.
Do you know how many people will be infected taking the patient from the airport to the airport clinic?
That's speculative, sir.
What? Speculative?
Very speculative.
Is it? Where is the garments that the people there would wear if such a thing happened? Do you see display there? Have you seen anything like that?
Our garments displayed, they are not displayed.
Huh?
I'm asking you a question. Are you satisfied?
I'm not satisfied. I'm not satisfied. I'm not satisfied because I'm scared that if Ebola gets into Ghana now, the number of people who would perish would be good. We shouldn't take it for granted. We shouldn't say that, oh, we have better health system than Liberia.
Napo, is it the absence of the inability of let's say institutions like the members of parliament or the legislature asking serious questions of the executive if you have these grave concerns?
Oh, I asked and Speaker granted a request for Parliament to be briefed. This morning around 10 we are meeting in Parliament to interrogate the issues my uncle is raising. But to see somebody critiquing a policy that has a potential to bring havoc in the country is being panicking or scaremongering, I'm not interested in that. And I find anybody who uses those words in the critique people are talking about as not being fully thinking through anything. And it permeates everything we are doing. It permeates everything we are doing. If you think that your country's advice is not worth it, if you think your own country's advice is not worth it, that's how you go and introduce foreigners, then I have a worry. I really, 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 really have a worry. And I want to know from the UN people where there is such a precedence that is happening in Ghana, and especially when there's such a fatal episode of Ebola. I'm very, very worried. They have not been able to bring the vaccines that the people, the foreigners who have had it, have gone to their country. The British went to Britain and got treated, even though we're being told that the vaccines are not available. The treatment, the person survived. And when they finished, they told us that probably that is all we have in this country. The Americans went there and they told us that is what we have in all this country. How come you had all you had in your country to treat your people who came, and Liberians are still dying? It is interesting. Why would Obama, if you could sit somewhere and do it, why would Obama send 6,000 troops to Liberia? It is not a disease you can treat by remote control. It's not something you can help by remote control. That's why everybody, the Foreign and Commonwealth Office in the UK, every volunteer in the National Health System who is going to Sierra Leone has been made to sign that he understands that he can get infected and die, or else they won't put you on a flight. When we are talking about public health emergencies, we shouldn't put it on the same platform as talking about our economy going to ruins. This can bankrupt our economy quicker than everything that we have done.
It's bankrupt Liberia's economy.
How can a whole nation like Sierra Leone be shut down for 4 days and we are joking about it in this country?
Liberia, the ministers, the medical doctors,
Sierra Leone was shut down.
They're all running away.
No, Sierra Leone was actually shut down for 4 days. You know that in terms of the economic loss, do you know the value of that? Please, let's put on our thinking caps. And not people always see this as criticism from opposition. My party hasn't even brought a policy, a stand on it. I don't think CPP has.
We don't have.
I'm telling you, I came and I started raising these critiques before everybody because I'm a doctor. Anyway, but I have, in the UN circles, I can tell you, people are worried in the UN circles about why Ghana should be chosen as a center. My uncle just said, there are floating ships. When there was a catastrophe in Philippines and Americans went, the first responders, interestingly, the first responders to the Philippine crisis were the Israelis. They were the first group. The second biggest group, when the Americans landed, the Israelis left because of the equipment they brought on their floating ships. The Americans,
when there was an earthquake in Haiti,
yes,
they went on.
Yes, the Americans, when they were going to Liberia, they didn't send a floating ship. They didn't send a floating ship because they can't transfer it where it is to the mainland. Let us put our thinking caps on.
You see, the other thing
you're saying we're not thinking.
Let us put our thinking caps on.
I'm asking, are you saying we're not thinking?
The other thing we should do.
Napo, are you saying we're...
We haven't thought through it fully.
Listen, the other thing we should do, we shouldn't politicize Ebola.
At all.
No, nobody is.
Yeah.
Oh.
So, ideally, what should have been done was that government should assemble all political parties, all stakeholders, round the table. How do we handle this thing?
People wouldn't have gone to the
meeting. Please. You are speculating. You are speculating. I said you are speculating.
To do with this health emergency.
Well, thank you very much. My guest for the morning, Kwame Jantua, is an energy expert, also a lawyer. He's the Deputy General Secretary of the CPP. Kwame, thank you.
Thank you.
Okay. And also Nanapoku, Dr. Matthew Opoku Prempe is a member of Parliament for Vinsha South. He's a member of the NPP.
He's my nephew.
Yeah. their relations. I think Ghanaians somehow you find as well as
you could be related to me. I don't even know.
Definitely. and so let me just run this by you. The cases could be 1 or 2 up. In Senegal, they have 1 case of Ebola, no death. In Guinea, 1,074 and counting. The deaths 648 and counting. In Nigeria, 20. So far, the deaths 8. In Sierra Leone, 2,021 deaths, and in 2,021 cases, 605 deaths. In Liberia, counting 3,458 and 1,830 deaths. I think Liberia seems to have recorded the highest so far, and so the total cases of death, we have 3,091 cases of death, and it's frightening.
Your
because I've been to Liberia a couple of times.
You are shaking by what you are reading.
I'm not shaking.
I don't feel it.
I am. I'm just imagining the street of Monrovia and the other counties.
So imagine if it happens in Ghana, the street of Accra.
No, even Accra. I'm talking.
You can't even imagine it, right?
Yeah. Okay, so thank you, my guests, and I hope to have you again sometime in the studio. We'll have to take a break. When we come back, we have a lot more for you on the show.